Hi, good morning. I'm Dr. Michael Palese. I'm the chairman of urology for Mount Sinai Beth Israel in downtown. We're here to discuss men's health issues, given that it's June and it's Men's Health Awareness Month. I'm here with my colleague, Dr. Stember, who is an expert in male sexual health and will give us some insight into this type of condition in men. As we all know, men are notorious for not seeing their physicians. They hate going to the doctor. Most of the time, I don't know about your practice, Dr. Stember, but most of the time men show up in my office with their wives or their girlfriends who have brought them to the office. That's because men notoriously don't like seeking out health care. So I think maybe we start there and discuss what type of patient do you normally see in your office?
Well, I see patients who are dealing with a variety of sexual health issues, including problems with erections, getting or maintaining erections, problems with sex drive, which may be related to testosterone level, problems with curvature of the penis when they have an erection, which is called Peyronie's disease, and male infertility. And it's pretty striking that when you talk to these guys, very often they've had an issue, a problem that's been bothering them for months or even years.
And I think you hit the nail on the head there. That's exactly it. Most men won't see the doctor, or will wait a very long period of time before we get to a sort of an extreme part of that condition, and they're being brought in by their spouse or partner, for instance.
They're either being brought in by their spouse or partner, or they are finally driven to seek help because of problems at home.
Correct. Correct. So you also brought something up about you see testosterone issues and issues with men having erections. And so one of the things that always strikes me about men is that they quite often their lifestyle choices are what contributes to these kind of things. We've talked a little bit about this in the past. So smoking is a classic condition that a lot of men still do. About 15% of the male population still actively smokes. Alcohol use, we see about 30% of the male population drinks alcohol, at least 5 drinks or more per day. I mean, those are pretty significant numbers. Right. Cannabis use or marijuana use, that's become very popular, and now in light of the fact that a lot of states are going to be going to recreational use, it's going to be quote unquote legal, I feel that there's going to be a potential for even more issues from male factors or male sexual health factors due to the cannabis use. I don't know what your thoughts are on that.
I mean, I think all those lifestyle factors you mentioned are important, and part of the issue is that almost all men understand that there's a connection between potential lung cancer and smoking and generalized health, but they often don't realize that it can have a direct impact on their bladder health, on their erection health, right, and on their sexual function in general.
Sure.
Sometimes when it comes up in that context, they're actually much more motivated to make some healthy lifestyle changes, and it can have a huge impact on them.
And that's exactly right. So smoking, I think if you ask men in general, they all know that it causes issues with their lungs, causes issues with their heart. They forget that there's bladder cancer is one of the number one reasons that from smoking, or one of the issues that you can get with heavy use smoking is bladder cancer. Same goes with kidney cancer. Kidney cancer is also attributed to heavy smoking. Erectile dysfunction, which comes from hypertension, and also vascular issues, also comes from smoking. Peripheral vascular disease, classic erectile dysfunction issue, and sometimes is a primary reason men to come to see you for erection issues, and then we find out that they also have cardiac issues. I mean, that's another association that we do say.
Right, yeah, and the reason for that is the arteries that go to the penis are about 10% of the diameter of the arteries that go to the heart. So if a plaque is 0.5 millimeter in diameter, it will obstruct the arteries going to the penis a lot earlier than the guy might experience chest pain, for example. But it turns out to be a really good early warning sign to get them to a primary care doctor for heart disease. Yeah, and often we discover a much bigger problem than the one they came in for.
So do you quite often, patients that walk in, let's say for an erection issue, do you send them to a cardiologist or to their internist to get evaluated for cardiac disease?
Very frequently there's a picture of poor systemic health, and they got into the office because they were worried about an erection.
Sure.
And we do treat that, but we help the guy get a whole set of lifestyle factors going in his favor as well,
right,
including some modifiable choices like smoking,
right,
getting cholesterol checked, and very often they end up on blood pressure meds, anti-cholesterol meds, and start diet and exercise, and they feel like new people. And that's not only good for them in general, it actually in turn significantly can make a difference in their sexual function,
sure,
which is the original reason they came in.
Of course, and I think that's another great point here, is that men are obviously worried about a lot of parts in their lives, but when it comes to erections, it's usually a reason to go see the doctor, and that's exactly where we find other issues or potential other issues that need to be worked out. So it brings us to a great point here. The Men's Health program, our Men's Health Center, which is some of the things that we want to create down here at Beth Israel, we are going to then incorporate, or be able to incorporate, a lot of these issues or general issues that men face. So the idea being that we want to have an internist who is devoted to men's health issues. We want a cardiologist devoted to men's health issues, a gastroenterologist, a nutritionist, and as urologists, we are the I guess the primary people who see a lot of men come in because they're going to see us regularly. We screen them as well for not just erection issues, but also things like prostate cancer. PSA, or prostate-specific antigen, is a blood test that is done once a year for men between basically the ages of 50 and 70, 75. There's a lot of controversy behind it, but as urologists, we still embrace the test along with other testing to make sure that men don't have prostate cancer. And that gives us a great segue to see men on a regular basis. Once a year, we see them in our office at the very least to make sure we get a blood test and examination.
Mm-hmm.
And that gives us a chance also to learn about their other health problems, whether it's erection issues or cardiac issues or gastrointestinal issues. And so I think that's also another topic of conversation. In terms of prostate cancer, how many men, when they're diagnosed with prostate cancer, how many come in with diagnosis of prostate cancer before you see them?
I usually see patients who have already had treatment for prostate cancer.
Right.
Because men who have any treatment for prostate cancer can expect some degree of impact to their erections or
Right.
sexual function, at least initially. And so my focus is to help them get back to their preoperative sexual function as quickly as possible. There's a lot of you have to be proactive, because the more time that goes on, the more difficult it is to get back to that point. So we have a program in place, and we're very organized about it.
So sexual health obviously can be impacted by a procedure that's been done, certain lifestyle changes, age itself as well. What's the natural aging process that occurs that can affect men's erections?
Well, it's interesting that I see patients of all ages with problems with erections, from teenagers to men in their 80s,
Mm-hmm.
and it's important to men in all those age groups. For the younger guys, typically it has a lot to do with stress, anxiety, adrenaline. They lose their erection on just one occasion for no particular reason. They lose focus for a moment, and then they have a lot of anxiety about the next time around, and that produces adrenaline, which in turn makes it hard to keep an erection. And they get into this cycle, which is they're essentially digging themselves into a hole.
Mm-hmm.
They're worried about their erection because of last time, and that causes them to have a problem with erection on that occasion. And so we help them break out of that cycle. So that tends to be the younger guys, and the good news is that's very reversible with some medication and a structured program. For older guys, as men age, they're more likely to have conditions like high blood pressure and diabetes,
Mm-hmm.
more likely to develop some cancers that need treatment. And so for those patients, the treatment may be different, but for almost every man, we can find a way to get them good sexual function again, one way or another.
So is it less the fact that they're aging, but more the conditions that they sort of acquire as they age? I guess that's the
Yeah, that's what I was trying to say. It's not the aging itself necessarily,
Right.
and it's just that as men age, over time they're more likely to have some of the conditions that cause problems if they're not focused on treating and preventing those conditions from becoming a problem. So.
I think that's actually a great point too, because men are taught, well, you're getting older, it's normal to lose your erections that way, but in reality it's not, right? I mean, the loss of erections is happening because of another process, and if we can control that process or reverse that process, whether it's diabetes or blood pressure or peripheral vascular disease, these are things that can be potentially treated and could then lead to normal sexual health again.
Right, and this is a big issue. Men attributing their loss of sexual function and ability to the normal aging process, and that's not necessarily the case for most of these men.
Right.
Many times they have a condition that can be treated, should be treated not just for their sexual function, but for their overall health.
Mm-hmm.
And often they have diminishing testosterone over time. Men lose about 1.5% of their testosterone levels every year once they get to around age 30.
Mm-hmm.
So there's a cumulative decline over time.
Right.
Men have decreased energy, decreased sex drive, decreased ability to have erections. And again, they just attribute it to normal aging process, but in many cases with evaluation, it can be determined they have a clinical diagnosis of testosterone deficiency, and that can be treated, and in many cases gives guys what they describe as a new lease on life. They feel 10 years younger, and they're very happy with that.
So there's the condition known as andropause, so the male version of menopause. You obviously deal with that a lot. You deal with men who come in with the symptoms you just described: fatigue, loss of libido. Is one of the first things you do look at their testosterone level? Is that always the cause?
It's not always the cause, and it's not a mandatory test for every guy who comes in for erectile dysfunction. You know, we do take an assessment of the patient as a whole, what their goals are, what their history is, a detailed sexual history. Look at their body mass index, how much fat and muscle they have, and just listen to the man. And he often can, through the history and the physical, we can get a good idea of whether it's worth it to test for testosterone levels, and it's in many cases it is. And usually I have a pretty good sense of who's going to have testosterone deficiency, but it's not 100%. So we have to do the testing for each guy, and then direct treatment to him based on what we find, and we have a discussion of the risks and the benefits of the treatment, all the things that can be done, and the patient has some options, and then he goes with something he feels comfortable with.
Terrific. Other men's health issues that we contend with, obviously kidney stone disease, kidney cancer, prostate cancer, testicular cancer. These are all things that are obviously, some of these things are found in women. Obviously prostate cancer, testicular cancer are not. These are very unique to being a male. Testicular cancer, as we know, it affects men more in their 20s and 30s rather than their 40s and 50s, while prostate cancer is usually a disease of slightly older men, 50, 60, 70. There's the old adage that every male will get prostate cancer if they live long enough. And I think there's some truth to that, and the question becomes then, is it a prostate cancer that needs to be treated? And nowadays we have many more tests and many more sort of parameters that we use to determine whether or not someone needs to be treated, getting surgery or radiation. And again, if you get treatments, this can also affect, again, your sexual health, and this is where Dr. Stember comes in. So a men's health center like what we want to create down at Beth Israel is going to be an important part of the community, and also of making sure that we can voice a concern for men's health issues. Right. Great.